All right. Good afternoon, everyone. Welcome to our Diversity and Inclusion Lecture Speaker Series at IOMA. This is going to be our first Diversity and Inclusion Lecture Speaker Series. Today, our topic is going to be addressing healthcare disparities and promoting health equity through acupuncture and herbs. As you know, we're celebrating Hispanic Heritage Month. Hispanic Heritage Month is a month to recognize the achievements and contributions of Hispanic American champions who have inspired others to achieve success. As we celebrate Hispanic Heritage Month at IOMA, we have our speaker, and I'd like to just share with you some information about our speaker today. Our speaker is Rocio Lopez, who is an IOMA alumni. She's a licensed acupuncturist and owner of the White Pearl Acupuncture and Herbs and is located in Brownsville, Texas. Rocio is of Hispanic heritage and has been intentional in her career journey and truly enjoys giving back to her community. Today, she's going to be discussing healthcare disparities faced by the Hispanic communities in the Brownsville area, and she'll be also discussing an ongoing effort to promote health equity through her practice, which is called White Pearl Acupuncture and Herbs. Without further ado, I'll pass it on to our dear alumni, Rocio Lopez. Rocio, welcome, and thank you for joining us today.
Thank you. Thank you so much, Demi. So I'm very, very happy to be here today to talk a little bit of what I know in regards to health disparities, promoting health equity. And she's right. Yeah, I am now I'm from Brownsville, born and raised. So I'm back here in my community, hoping that I can offer it a little help and just to kind of make things a little bit more accessible for my community. So I'm going to move on to the next slide. Okay, so I want to talk a little bit of what health disparities are. So health disparities are preventable differences in populations that are socially disadvantaged. So this may be from socioeconomic status, it may be for individuals who are uninsured or underinsured, race and ethnicity, some form of disability, and behavioral factors. So these are basically things that prevent them from achieving their optimal health. In health equity, it refers more to individuals achieving their highest level of health through the elimination of these disparities. So this means to have fair access to these healthcare professionals, healthy food, safe environment, and just to be well across life, work, and medical care. So I really like that little graphic there. We got a nice diverse group there. And so I wanted to include this quote here. The essence of global health equity is the idea that something so precious as health might be viewed as a right. I really like the little sass in there, but it's definitely something very true. We should be all across given the opportunity to have health care accessible throughout everyone, regardless of what we are, who we look like, or our background. All right, so going back to, talking about health disparities and health equity, I wanted to give a little background of more than anything, my focus, because it'll be more based on my experience and what I see in the area where I practice. So I want to say that might affect the way it shows to be compared to other cities, although there's a lot of similarities because I did speak to somebody in Austin, but there is definitely some things that kind of change here and there amongst the two of us. Here in the border, right? So I'm part of Brownsville, Texas, which is the southernmost tip of Texas, the city at the very, very end of Texas, along the border with Mexico. And so you can see that in the top picture or the middle picture with the Texas, the little yellow strip there is mostly the Rio Grande Valley, which is a strip of cities along the border. They are all basically sister cities to Mexico, but they're all in Texas. So there is definitely a very, very high population of Hispanics here. And within the Hispanic community, there is like an 85-90% of Mexican American descent, or first generation, second generation, and so on. Spanish is definitely part of the primary language. So for us, it's very important to know Spanish, because that's the way you're able to communicate with your abuelitas, with your aunts, with your mother, at home. And then the English is then learned in school typically. So here's a little bit of the pictures I wanted to share that sort of represent the area, the geographic, and the culture as well. In the top left corner, basically where there's kids playing and you see a border, that's actually an elementary school that's sitting right pretty much on the border. This is on the US side. So there's kids playing, outdoor in the recreational area or time. And the proximity of the border, which divides the two countries, is very, very close. So this is something very normal. We see there's schools, that along the border, there's houses, there's even properties that extend on both sides of the country, US country and the Mexican side as well. So, this is the kind of living areas that we live in. As you might imagine, there's a lot of mixed culture here. So there is some Mexican, and then there's a little bit of, US mixture, which makes it a very unique place as well. So going on to the next photo down below, we see, the 4 horses and the 4 mariachis on the horses holding the US and the Mexican flag. In that specific picture, that's an event that we have. It's called the Charro Days. This was originally, created to celebrate the sisterhood cities between Brownsville, which is the place where I live in right now, and Matamoros, which is the sister city on the Mexican side of the border. And in this event, it's very nice because everyone dresses in traditional Mexican clothing. So you see people dressed in mariachi gear, mariachi outfits, women with their beautiful dresses or shirts. And some people also dress up as cowboys, cowgirls, because, there's a mix of the two. And this celebration actually lasts for 3 days, and it ends over in a park downtown. They basically parade downtown on a street. They close up the street, and then we end in the park. And in the park, we have a festivity called Sombrero Fest. And in this fest, again, it's just a lot of music, a lot of good food, lots of dancing. It's very, very fun days for us. So this happens around February. But it's one of the many celebrations that we have in our culture here. This is actually just in Brownsville and Matamoros. So this is the unique to our city. In the top right hand, we see palm trees. And the reason why I did add the palm trees is that you find palm trees all over the valley, really, not just Brownsville. They're beautiful. They have just a very unique aspect to them. Unfortunately, these palm trees do not offer us coconuts, so they're really just there for the look of it. But it's really nice to have that scenery for us. And then right below, we have the parrots. These are native to our city. They have really beautiful, vibrant colors. Very obvious to see them because they're very loud too. But yeah, so this is a little bit of what Brownsville is. Alrighty, so going more into the discussion of barriers and disparities of healthcare. I spoke to one of AOMA's alumni. His name's Derek Flores. He is he is from the US, and he was born in Puerto Rico, so he knows Spanish very well as well, and he actually does work with the community, or Hispanic community there in Austin. So, we kind of discussed a little bit of what we thought were some of the barriers in our experience, and he was able to share a little bit of what he's seen so far in Austin. So in Austin, there's a lot of community clinics, a lot of community health care. However, there are a lot of cracks, especially for the underserved or the undercovered, which means like insurance. Because there's such a large crowd of people, in community settings, unfortunately, the healthcare may not be to its highest quality. So this pushes individuals to rely on the emergency room for a lot of primary care issues, things that could have been addressed beforehand. There's definitely a non-existent preventative care system, especially amongst the minority groups such as Hispanics. And then there's also a lack of education, in many times, and I've seen this myself too, but in what some of my patients think would be a healthy option is really not, and there's that whole misinformation of what is good for them and what is not. So this goes more into like health literacy and a little bit more health education. And then there's also the predisposition. So a lot of people think, well, it's genetic, and there's nothing else that I can do about it. However, there are a lot of lifestyle habits that can be changed that are not addressed. And, living in a population where this has happened for generations, it's really hard to break out of that unless they're told to or educated on the subject. All right. And then, so factors that place minorities like the Hispanic community at risk for health disparities. So in the area that I serve, which is the Rio Grande Valley, this is considered a medically underserved community. So what does this mean? This means that we have, high infant mortality rate, there's a high elderly population, and there's not enough physicians for the amount of population. So some of the things that happen is that there's shortage of physicians or specialists. There's not enough for the amount of people that we have here. Obviously, this leads to lack of access to quality healthcare. This affects us. And then also in the Hispanic community, there's a lot of uninsured population, and self-pay is unaffordable for them. In some cases, immigration status can also, keep them from reaching out for help because they're either afraid, they're misinformed, they don't know, or they just can't afford it. There's also the health literacy, there's not enough ability to know what medical options is available to them. A lot of the population of the Hispanics fall in the lower class, so they either cannot afford insurance or the healthcare cost. And ironically, even though we live in a border, city, there are many times where they lack access to Spanish-speaking healthcare providers. Something as simple as that. They're unable to communicate properly because there has to be a translator in between. But giving this middle person doesn't, sort of breaks up that trust from patient to practitioner, and then the ability to communicate just kind of is broken off a little. Timeliness matters, because there's a lot of there's not enough physicians, then appointments can run out to 1 or 2 months out from the time they need the treatment or they need the care. There's a lot of maximized production over quality. Patients can be sort of what you would say, quote unquote, lucky if they see the primary care. Sometimes they need to see, their physician. Sometimes they need to see the nurse practitioner or the physician assistant instead of their primary care. So what happens many times, like at least in my community, because we have this accessibility, not for everyone, because again, we'll go back to the fact that some people don't have the immigration status, or some, right now with COVID, there's a lot more restrictions to travel to Mexico. But many times before, people would just travel right over to across the border to Mexico to get healthcare. Because the cost was lower, the accessibility was, much easier. There's the ability to communicate, and so this all just gives the patient a little bit more trust, to go into these areas instead. So some of the efforts to advance health equity for the Hispanic community. So I think what helps me a lot is the fact that I'm able to communicate in Spanish. And obviously, given the fact that I'm from here, I'm culturally competent with them. This just already sets sort of the tone for the treatment. Patients feel more at ease, they feel that they can trust me. And that they're able to really openly talk to me about what they feel, and their concerns, or any form of pain they may have. I do use preventative care model from the start. So I start raising awareness to patients about changing lifestyle habits early on. I try to be very raw to them and tell them the way things can go about if their eating habits continue the same, or the sleeping issues, or the stress, and so on and so forth. Another thing is, offering chronic pain management options through acupuncture. This helps patients avoid the overuse of medication. I've had patients who rely on gabapentin every day and have been able to get off of it, or reduce the amount that they need. And so this is something so important, because we know that overuse of medication can eventually cause more side effects into the health of these individuals. Also educating patients on behavioral factors such as eating habits, drinking alcohol, or holding that same predisposed idea, kind of what the other slide said, thinking that everything's related to just genetics only, and then just keeping the same lifestyle habit. Of course, it's going to lead to the same outcome if there's no change. So I try to make that clear to them, and I educate them, so kind of give them a little bit more of that clear picture. I try to foresee and prevent and raise the alert when is necessary. So recently, actually, I had a patient who had an enlarged liver. I didn't know this, and he didn't know this, but I was palpating his abdomen that day, and he was actually there just for insomnia. He was trying to reduce stress and help with sleep. But when I went through trying to palpate liver 14, trying to get to the end of that channel, that's one of our acupuncture points along the rib cage. I realized there was some swelling, and so I asked him if he had seen his primary care. He had not. So I told him, you need to go see your primary care. You have to let them know that you're having slight swelling, on your right quadrant or right abdomen area. And so he did, and it turned out that he had enlarged liver, and his liver enzymes were a little elevated. So he was, let known of that before, anything else, happened. So do you think focus? Yeah. So I believe that there has to be a focus on both equity, health equity, but we cannot ignore, obviously, the disparities. So the health equity will help us construct a model where everyone's able to access healthcare and meet their medical needs. But by being able, we're able to reach these solutions through the disparities that are already present. So the disparities will help us see and put attention to the places that are needed. All right. And then here, so we talk a little bit more about the diversity and inclusion and the need for it in acupuncture. So of course, we're in need to be able to offer healthcare to individuals of all backgrounds, just because, that's a right, that's something we should be doing regardless. But this can also help increase better patient outcomes, allowing each patient to feel valued, listened to, and trusted. This helps diverse populations as well feel valued and gain equal access to all healthcare opportunities, including acupuncture. Diversity in the healthcare, such as acupuncture as well, can lead to cultural competency. And unfortunately, for time being, acupuncture has been considered a form of medicine rarely available to low-income populations. There's a study that, kind of talked about it a little bit more, and it says low-income minority samples experience disparities in the prevalence of chronic pain, in perceived access to effective pain treatment, and in consultations for pain. A great deal of literature suggests that acupuncture offers potential benefits in the management of chronic pain, but is rarely available to low-income patients. This is very ironic because the population that certainly needs acupuncture rarely has any access to it. Alrighty, and so we do have, some patients that are open to doing acupuncture. Some are a little bit more, apprehensive about it, kind of think about it twice. In my experience, the ones that are motivated, they feel familiar with traditional medicine and healing. I think the accessibility to get acupuncture has definitely, helped as well. In the past, before I came back to Brownsville, the closest acupuncturist was in McAllen, which is a city that's about an hour from Brownsville. And unfortunately, the practitioners over there don't speak Spanish. So that was one big barrier for patients to go to them. I actually had a few patients tell me that, they had gone, they sort of liked the treatment, but because of the lack of communication with the practitioner, they felt that they weren't being listened to and that they weren't able to express all the concerns they actually had. So for that reason, they stopped going. So going back to that, they're able to communicate with me, directly as a practitioner. I speak the language. I can, listen to them and hear them out, anything that they may need. There's also an acquired trust and sense of familiarity between the patient and practitioner before the acupuncture is performed. So I think with that being said, I mean by the fact that I am from Brownsville, they see the credentialing process, like the master degree, they see that I'm licensed, all of that motivates them to come to me just because they know that this is, something that's being overseen by a bigger, organization, and they know that it won't be something that can be dangerous to them. So on the other hand, for those who are misinformed, of course, we always still have those that believe that acupuncture is just based on placebo effect. Some people do fear needles and they believe the needles are going to be very painful. So, offering other forms of traditional Chinese healing, such as acupressure, moxibustion, or cupping therapy, all of that helps them or motivates them to try out acupuncture. And then there's also the lack of knowing, some patients just don't know what acupuncture can do and how it can help them. So acupuncture benefits. So some of the things that acupuncture can help with is chronic pain, preventative care, palliative care, recovery post-exercise, weight loss, withdrawal from substance abuse and alcohol, smoking, and stress relief. So this really helps with heart rate variability. That picture there, that's actually from an event I was part of where there's individuals cycling 30 miles from Brownsville to our island, South Padre Island. And I was able to offer a regular acupuncture to each of them once they reached the island. So that was really fun. Alrighty, so that's what we have here. And does anybody have any questions?
Awesome. Wow. Thank you so much,
Mhm.
Rocio, for putting this together. A lot of, important information you have touched on. I do want to open the floor up for any questions that any one of us may have. I have some questions myself,
Mhm.
so I can definitely start it out, you know,
Yeah.
and just with the questions that we have. So, wanting to know, so I know you mentioned the way you were able to like reduce the barriers with your patients, especially in the Hispanic community, was basically being able to be fluent in Spanish, right?
Yes.
So, as we think, long term and forward, how can future practitioners, at AOMA, for example, be more equitable, by reducing some of these barriers, if they do not speak Spanish? You see what I'm saying? What would you suggest and recommend uh, to be offered?
Yeah. Really, I think it really just comes down to trust. And them feeling like they're being listened to, even though it's not directly like through third parties. I know I mentioned like typically here, some patients have to rely on somebody to translate for them, and that's usually okay if the practitioner, um, is able to show that interest to the patient, right? Um,
Mhm.
and that's something that I typically see, and I see this like also firsthand with like my parents, because they're both Mexican, and they don't speak English. And so
Mhm.
when they visited their own doctors or specialists, you can see the difference from the ones that they're his, like for example, my father's urologist. He's
Mhm.
African American, and he does not speak a word of Spanish, but he shows that interest, he shows that time for the patient. And I think that's
Mhm.
something that they value a lot, being able to
Mhm.
feel that value of patient, and not just kind of in and out, and depending on the translator only. um yeah, so that would be kind of something I would advise on. um yeah, it's just the speaking does do a
Mhm.
lot of like, it is very important, but it's not the only thing. Yeah.
Okay. Makes a lot of sense. Just having that compassion, value, care, and just showing that, as a practitioner, the person cares, and also
Yeah.
making sure, I guess, it's not much like a transactional visit, I guess,
Hmm.
uh, in the process. So, okay, awesome.
Yeah, what I've
Uh,
also seen, or I remember, at least, is like when I was in AOMA,
mhm,
something that patients would really love, even though they could see, obviously they weren't from the same ethnicity or race, is them learning even like 3 words, like just like hola, just simple as
mhm,
that. That
mhm,
already kind of sets the tone differently, for them.
mhm,
And you know and that tells the patient, because I remember even a patient telling me he doesn't know it, but he's trying, and that you know
mhm,
that makes me like him, or that makes me trust him. And so that,
mhm.
those would be some things that could also be added on.
Oh, awesome. Great
Mhm.
example, Theo. Mhm. Thank you
Yeah,
for sharing that.
thank you.
Okay. What about like, I know we had a conversation about asking questions about the patient's health other than the actual services that the patient's coming for with acupuncture. So, like, just ensuring that this patient has made a visit to their primary care, uh,
Yes.
doctor and things like that. Do
Mhm.
you think that definitely helps with breaking these barriers, and making our society more, equitable when it comes to the healthcare?
I think so. I think this also sort of helps us too in our like practice as well. Because, checking in to see, when was your last visit? When was your last lab work? Have you done your, regular checkups, things of that sort? That just gives like another person checking in on that patient, to see if they're following through with their own, preventative measures, such as getting testing done. And sometimes in some cases, some patients don't see, like they don't have the ability to go get their regular checkups like everyone else, because, again, we're back to they might not be insured, they cannot afford it, or they kind of leave it as last, their last thing to do. And so if you're there, if you're present with the patient and you have them there with you, the important thing is to do as thorough as you, or be as thorough as you can. Because typically, at least in my office, the population that I'm seeing are those that don't have that access so easily, to see primary care, and have them tell them, Yeah.
That's great. And I, just by doing different research and even being a patient myself, I know what helps me is having, providers having referrals, in this kind of situations. I think that takes away some of the stress that can be impacted and the burden that can be impacted on the patient side. So do you feel like, I don't know if you offer those services, like maybe a referral service for like a certain kind of provider or things like that. Do you think that would be useful, with just the conversation we're having right now, to reduce the disparities in healthcare, and just being able to provide the extra resource to the patient?
Yes. Yeah. Oh yeah, definitely. Because a lot of times patients, you tell them you need to go see a specialist, you need to go see a chiropractor, you need to see this or that. And, if you don't give them where to go, if you don't give them options, they won't know. And yeah, it's always better to assume that they don't know, and you offer that already for them. That also ensures that they have something with them in paper, and reminds them as well to go and follow through with the referrals or recommendations.
Great. Awesome. I want to basically see if any of our attendees has any other questions for you, because I just don't want to be the one asking all the questions, because I will ask.
Yes.
I do have a question for you, Rocio.
Yeah.
First of all, I wanted to thank you for taking time to speak with us today. But my question is specifically towards the structure of how to help underserved populations. How can we do that? Especially with the patient population that might be in the low income bracket. And I guess the structure that I'm asking about is, would we take mobile units and go out to the underserved communities? And if they are low income patients, could we do treatments that were either free, or are they a fixed rate treatment scale, or are they income based, or what would that look like?
Yeah. So far right now, in my clinic, I haven't really developed that, honestly, but I'm definitely working on it. And what I think and I see is it would be more of sort of a community style, with a sliding scale or based on income, because patients, once they know, like when patients see and feel the benefits from acupuncture, they will do everything to pay. But of course, you always want to make sure we're helping them as well, right? So I think definitely a sliding scale would be a good option. And community style really just opens the door to help, make the payments, or make the cost of acupuncture lower. And so, because you can obviously see more people at the same time, it can be, different sorts of periods of time. with a mobile, I would say yes, but I've never really have had any experience in doing mobile acupuncture other than the auricular acupuncture that I did for some time with Acupunctures Without Borders, and this last event that I did. But with that, you just want to like always consider timing, resources and all of that. But I think the community style would be probably the best choice.
Okay, awesome. Thank you.
Yes, you're welcome. Thank you for the question.
That was a great question, Anne Marie. Thank you for asking that question. Definitely more education. I think, as you touched on, Rocio, more education on the medicine and what it is really needed.
Yes.
For sure, to the community in general, because I think a lot of minority populations are just not aware of what the benefits are that
Yes.
acupuncture, can provide.
Yeah. I will say that here what I've come across is a lot of people just think it's for weight loss. And the reason why is because apparently a few years back there used to be somebody doing acupuncture on the other side of the of the border in Mexico, and they used to do auricular acupuncture for weight loss. So everyone just assumes now that, or we're assuming now, they're starting to learn that it's for many other reasons, but everyone just assumed that acupuncture was for weight loss and nothing else. So there's been that sort of like misinformation, and now with me promoting it and marketing it and having patients come in and talk about it, that's helped open the doors for more different settings, more different patients with different needs. But originally they would have been stuck with the idea of just weight loss if it wasn't for me to talk about it a little bit more.
That's great. Okay. So more education on that, definitely, as you suggested. So, it's a lot more for sure than weight loss. There are a lot more benefits of acupuncture than that. Okay.
Yes.
Definitely. Okay. I'm trying to see if I have any other questions for you. I really, really appreciate. Do we have any other questions? Any of the attendees? Doesn't sound like it. Okay. Rocio, I really, really want to thank you for putting this information for us today and having this conversation. This is our first lecture speaker series on diversity and inclusion, and I really want to thank you for taking the time to put this information forward for our students. We definitely will continue to be in contact with you. Please let us know if we can assist you, in any way, shape or form here at AOMA.
Thank you.
If we do not have any other questions, I will go ahead and end this speaker series for us. And students, if you have any questions for Rocio concerning, her discussion and her presentation today, please feel free to send me an email and I will pass that information along to Rocio.
Thank you.
Hoping that's okay.
Yes, of course. Yes, you can share all of my information. It's everywhere anyway. So yes, you are free to do so. Thank you, Dami, for also inviting me. I'm very happy I was able to do this. I hope I was able to share, new information for some, and this can help bring more awareness of the need for health equity in our communities.
Awesome. I just want to thank you again for all what you're doing to, break that barrier, and reduce the disparities, in the area of Bronzeville. And let us know if we can help you. And if nothing else, thank you so much, everyone, for joining us. And we will see you next time.
Thank you.
Thank you.
Thank you.